Welcome to my presentation on hospital readmission analysis. In this project, I explored hospital data to uncover the factors influencing patient readmissions with a focus on age, diagnosis pattern, and diabetes management. Problem statement. Hospital readmission are a major concern for healthcare systems worldwide. They often indicate underlying challenges such as poor discharge planning, ineffective treatment follow-up, or chronic disease mismanagement. Frequent readmissions not only increase hospital costs but also impact patient outcomes and overall quality of care. Understanding what drives these readmissions is key to improving hospital performance and patient well-being. The goal of this analysis was to identify the most common primary diagnoses across different age groups, to examine how diabetes and its medication affects readmission rates, to assess how readmission rates vary by age group and draw insights that could inform better healthcare interventions. This chart shows the distribution of primary diagnoses across different age groups. Circulatory diseases dominate across most age groups, especially among age 60 to 80. Followed by other conditions and injuries. This suggests that as we age, circulatory-related conditions become the leading cause of hospital visits and readmissions. Younger groups show slightly more variety, including injuries and digestive issues, while the oldest age bracket, which is 90 to 100 years, has fewer total cases overall. This bar chart shows the comparison of readmission rates between patients who were and were not on diabetes medication. Patients without diabetes medication had a slightly higher percentage of being readmitted, that's around 41%, compared to 48% among those on medication. This pattern suggests that while medication helps manage diabetes, it may not fully prevent complications leading to readmission, possibly due to comorbidities or late diseases in the future here. Here we are looking at the average readmission rates changes. We look at how readmission rate changes with age. The trend shows a gradual increase in readmission rates from 40 up to 80 years, peaking around 70 to 80 age group before slightly declining among 90 years and above. This pattern aligns with the earlier finding that circulatory and chronic conditions are more prevalent among older patients, increasing the likelihood of readmission. Insights. Circulatory diseases are the most common diagnosis among older adults and a major contributor of hospital readmission. Diabetes patients, especially those under medication, still experience significant readmission rates, indicating the need for closer management. Readmission risk increases with age, peaking in the elderly population, who often have multiple chronic conditions. Based on these findings, I recommend that the hospital implements targeted interventions for elderly patients, particularly with circulatory and diabetic conditions. The hospital should enhance post-discharge monitoring and follow-up care to reduce preventable readmission. They should also promote chronic disease education for patients and caregivers to improve medication adherence and self-management. I also recommend that they use data analytics to continuously track and predict high-risk patients for early intervention. In conclusion, the analysis highlights the strong link between age, chronic disease, and hospital readmission, improving care coordination, patient education, and chronic disease management could significantly reduce readmission rates. Data-driven insights like this are essential to advancing patient care and optimizing hospital performance. Thank you.